1,500 health experts from around the world are gathered in Atlanta for a conference on emerging infectious diseases. They're expected to focus on responses to new COVID variants and monkeypox outbreaks in parts of the world. Now, joining us now to discuss it, we have Scott Ratzan. He is the editor-in-chief of the Journal of Health Communication, International Perspectives. Thanks so much for your time there, Scott. Now, what will be the top priorities, do you think, at this conference? We talked about the monkeypox outbreak specifically. How scared should America be, do you think?
Well, thank you for having me. And indeed, it's great that the experts are getting together again in Atlanta. They have this meeting every 3 years. And it's very important that we think about the CDC for the Centers of Disease Control and prevention. And the end prevention often is forgotten. And I think that's what's really important here today, is that this meeting should focus, as you've set up, the importance of prevention. We can prevent disease, we can get vaccinated, we can look at not only the situation with COVID, but the fact that we have flu around the corner, and flu season will be there. We need to prepare for it. We also need to be aware of the situation with monkeypox and not worry about it at the same level that we might with other vaccine preventable diseases. So it's important that we put all of this in context and realize that much of what we do in public health is about prevention and not only about the treatment that we might have in medical care.
Now, in terms of the coronavirus pandemic now well and truly in its third year, how do you imagine the next phase of policy will start to reflect the way society is adapting to coronavirus specifically, but also more broadly public health, as you spoke of several different viruses that are now in the community?
Well, ideally, what we would try to have is a health literacy, that people would understand the importance of health and how important it is to take care of yourself, your family, and your community. I think the policies that we had initially were, frankly, uninformed in a very quick basis because we didn't have any cure. We didn't know if people or how many people would die from this disease that we first called SARS-CoV-2 or coronavirus. And we have had well over 1 million deaths in the United States and millions globally. So it was not unfortunate that we had such a bad response. But now that we're at the place, as I think you're asking, Sally, what are the right policies? When do we mask? How important is it that we get everybody vaccinated, not just adults, but kids? And kids vaccination is behind. And how also do we prepare with new boosters that we'll likely need for these new variants that are not if they are new variants, but when these variants come out. We need to be prepared.
Now, with vaccine inequality still a major issue, we were just reporting yesterday that Australia has a glut of vaccines while developing countries are still in dire need. How might vaccine equity be addressed?
Well, ideally, we have these systems in place, whether it's with this COVAX, with Gavi, the epidemiology preparedness groups that are out there. All of these groups are trying to get vaccines in the right places, but these need both policies, and we need both supply and demand. And this requires governments working together. This requires our international system working together. And I think part of the challenge has been, initially we had, frankly, too much bilateral. And we've had, as you're mentioning, maybe too many vaccines in some countries and not enough in others. So maybe there's a better way that we can do this through some strategic health diplomacy, but that's easier said than done. And I'm hopeful that now that we're, as you're mentioning, in our third year of this, that we can do better, and we must do better. And we must get everybody together, business, academia, all the governments that are involved, and frankly, all the best thinkers in the world to make this pandemic go away.
Now, of course, we know that monkeypox is not as concerning as something like coronavirus, or certainly as it was when it first started to transpire across the community. But now that it's spreading, it's certainly catching health officials off guard, isn't it? I mean, do you think that they should have been paying closer attention to how this disease was spreading in Africa, and what kind of strategies are likely going to have to be put in place to try and limit the spread now?
Well, in reality, it's been endemic in Africa for a number of years, but there's only 345 cases that are reportable now of the 28,000 cases of monkeypox that are around the world in countries that had not seen it in the past. This caused the World Health Organization to call this a public health emergency of international concern. But unfortunately, there's not a lot of what goes with this public health emergency. What should we do is on an individual country basis where there is monkeypox that's endemic. And that means getting people tested and getting people vaccinated who are eligible for vaccination, and stopping those who are positive, who have the lesions or the pox, to stop infecting others. And that should be how we address monkeypox, and not worry about it's certainly not going to be the next COVID, and we have to really stop it in its tracks now.
All right, Scott, really appreciate your time. Scott Ratzan there, Editor-in-Chief of the Journal of Health Communication.
Thank you.